These are my three favorite things from a manual perspective that I do when working with risk patients. My name is Wong. I'm an occupational therapist and certified hand therapist, and over 10 years ago, I started my therapy clinic. And over 5 years ago, I started Secrets to share what I do here at my clinic and also just to help therapists develop their clinical skills so they can have what? More choices in their career. It sucks when you are doing stuff and you just don't know what works and what doesn't work, and you're not making progress with your patients. So, I'm going to share with you three things that I teach inside the manual therapy workshops that I have. I'll include those. I have, every year I go on several trips to teach my manual therapy workshop across the United States and also overseas as well. And if you can't travel, you can go to my website and do the course online. It's broken up into 4 mini courses: hands, wrist, elbow, and shoulder. I'm going to share with you a few things that I teach inside there that I love to do with all my wrist patients, right? So don't just grab people and push them up and down. Those are gone. Those days are gone. Okay. Those days, I used to do that. I used to do that. That's why I'm sharing with you that there are other ways to do it, because I don't know. That's just what I saw when I first started coming up in the, hand therapy space. I would just see people just grabbing arms and, hanging them over and just stretching them. And it's not that they don't work. I'm sure they work, but your patients can be really painful and it takes a really long time. So I just teach a different method. It's not that it's not painful. It's just relative to what's going on. And I like to teach people to work into ease versus restriction. And so from a joint perspective, all right, we're going to go into a couple of different aspects of manual. But from a joint perspective, you have the distal radius and the ulna, and then you have all your carpal bones, and then you have all your metacarpal bones, right? And so I was working with one of my patients that came in with a distal radius fracture, and she was telling me how her therapist had shown her how to just grab her hand and push it into flexion, and then grab her hand and push it into extension. And she kept focusing on flexion because she was like, that's where it hurts the most. That's where it hurts the most. And I understand wrist flexion actually hurts more, but getting wrist extension is really much harder in general because we have a lot of ligaments on the back of our hand that sort of get in the way. So, believe it or not, wrist extension, though, feels like it's harder, it's actually easier than flexion because it tends to be less painful, right? Again, pain is relative because when your patients come into you and how they come into you play a role, right? But one of the things that I really like to do is work into extension instead of flexion. Extension is harder to get. It's actually more, I would say it's more important because in order to be able to use your hands and wrists, you want to be able to put weight through your wrist, right? So one of the things I like to do is I like to go into more of extension than into flexion. So one of the ways I do that is let me see. Here's your pisiform, right? And at the base here is your scaphoid. And you can actually, when you're working on extension, you can actually kind of like do a lift and a scoop up, right? I can't really show it. Let me see. If I'm working with someone, right? You can kind of do a lift and a scoop up, and then you're going to push their wrist. So you can actually use all of your hand and push their hand up into extension, right? And then you use your other hand to have pressure on their forearm. And it's a great way to save your hand, but also work into extension. Here, let me see if I can show you. Right? So if their hand is across mine, sometimes I will put my hand under their hand and kind of do this lift and scoop up and working from their metacarpals. But that's one way of working it. There's so many different ways, but that's one way that I like to work with them when they're really new and they're a little bit more painful and stuff like that. Another way I like to work with them is I'll hold their hand. I'll put my hands in between their hands, right, and then I'll work into wrist extension like this, putting giving them the pressure here at that crease. So I'm in between their fingers. Oh my God, there's no space in here for me to show you. Now I'm going to have to create something silicone hand. But basically, you want to make sure that you're pushing from a metacarpal standpoint, right? I really have to have someone else here so I can really show you. But yeah, that's number one. You can do some passive range of motion and it can be really great, right? From a joint perspective. Number two, I like to work with the muscles. So again, if we're going into ease versus restriction, oftentimes we think, oh my God, if I want to stretch my wrist extensors, I'm going to go into flexion. But actually, if you put them in a shortened position, think about how you shorten your wrist extensors. You actually would put the wrist into extension and you put the elbow into flexion, and you can work the soft tissue right here, so muscles and tendons, and you work it in a shortened position. And then when you go and you make it long again, check your patient, see if they're less painful. The other thing is you are working on flexors. So a lot of times we tend to work on extensors and we forget like, hey, these flexors need a lot of help. And it's because we're constantly going into flexion. If you've ever worked with a wrist patient, you'll see that when they go into flexion, they tend to pull their wrist down just because our flexors are stronger. So our flexors, here's your medial epicondyle, right? You can be above and below there, and you want to make sure you're working those flexors. And again, they tend to sit a little bit more ulnar than we would think. So it's hard to like work with your patients like this, right? So if you can, I love to do it this way. I put them in supine and then I can actually externally rotate them a little bit, and then I have access to all of this, all of this space right here. And the way you can work it is you can bring the wrist into a certain amount of flexion, and then you can bring the elbow into flexion, and it will shorten your wrist flexors and finger flexors. So you can shorten it, and then you can do cross friction. You can even go from long to short. Like you can encourage, um, you know, insertion to come back to origin, just kind of shorten it. This can be very, very good for your patients that are, are sore, they're painful. You can feel that they're really tight at their wrist level, and it's because the muscles that go to the wrist to move the wrist actually start in the elbow. So if you work the elbow, it's going to be really helpful. And then number three is your wrist can't get better unless they have really good supination and pronation. So don't discount working people's forearm muscles to work supination, and then also to work pronation, right? And then we can work in between. So I like to use the sides of my fingers to get in between, especially at the DRUJ, like right here. Our pronator muscles right here, so you can get it from a supinated position. So you see, you put your fingers together. This is why I tell hand therapists, y'all, people can't have long nails because you have to kind of come right in between these two bones. You got to sit into it underneath it, push up while the weight of their arm falls down into your fingers, and you can do cross friction, trigger point, that kind of stuff, and you can work it all the way up. Don't discount supination and pronation. I would say don't discount pronation, because sometimes when they have supination and pronation, but they still have a lot of pain at the wrist, they might not have as much pronation as you think they have. So lock their shoulders down and check their supination and pronation for real. For real, for real. Okay. So do those things. Make sure you're checking from a joint perspective. Do I have enough joint motion? Right? If I don't have enough joint motion, I might have a capsule issue or I might have a muscle issue. If I have a capsule issue, then I need to mobilize at the capsule level. If I have a muscle issue, then I have to mobilize at the muscle level. Majority of the time, it's a little bit of both. And then you have to prioritize what are you doing first, second, and third. And then don't forget that you have to work supination and pronation anytime you're working with any type of wrist issue, because you have to be able to supinate and pronate in order for the wrist to fully be able to move. So if you have someone who you can't get rid of their pain or you can't make progress with some of, the stuff that you're doing based on their diagnosis, don't forget to check supination and pronation. Majority of the time I can tell you what, you're missing it. So double check those things. If you want more help, we have the mentorship program in the month of August. We are going to be covering wrist injuries, how to evaluate them, their protocols and treatments and how to progress your patients essentially. And if you're watching this after the fact, you can still get access to it. The mentorship program has a huge library of videos on how to evaluate and how to treat, and it's going to help you determine like, hey, what's going on? How can I progress my patients better? Right? So the mentorship program, I'll leave the link below. And we also have my 2-day manual therapy workshops. In 2025, we're teaching in, I think it's like 3 or 4 places. In 2024, we did 6 places. So whenever you're seeing this, we have one last course in California. It's going to be in Pasadena, California, November 8th and 9th. That's our last one of 2025. And then we're going to have a bunch more in 2026. So just, like the video, subscribe to the channel, get on my email list if you want. The links are all below. You're more than welcome to, send me questions, ask me if it's right for you or not. People ask me that all the time. Like, should I do this course? Which course should I do? Blah, blah, blah. I'm happy to direct you into the right, course based on where you are in your journey in hand therapy. So let me know. Let me know. Those links are going to be below for you. So if you want to learn more about what I do from a manual perspective, I share so much more in a 2-day manual therapy workshop. And if you want to just be online and continue to learn, check out the mentorship program. No matter where you are in your journey, I'm here to support and help you. So I hope to see you on the inside.